So let's get started. Good evening, everyone. My name is Melissa Molina Trinidad, and I am the founder and president of the NALHE Tri-State Chapter, past president of NALHE Tri-State Chapter. It gives me great pleasure to welcome you to our Latina CEO series, Leading the Way. If you're new to the NALHE family, I'd like to take a few minutes to share with you highlights of a professional organization. NALHE is an organization that began in 2005. Our mission is to promote health equity for Latino communities by increasing Latino and Latina representation within healthcare systems and by supporting policy, legislation, and regulation that seeks to improve health and healthcare for diverse communities. Our vision sets the runway for our future to be the professional association of choice that transforms the Latino and Latina experience in the national healthcare leadership space. We promote and practice authentic leadership, being genuine, self-aware, and transparent. We want to inspire loyalty and trust. We champion diversity, equity, and inclusion initiatives. We advance various perspectives and ideas, and we strive and work diligently to position you to have a role, a voice, and a seat at the table. The NALHE footprint spans across the U.S. via multiple chapters. Our growing members and partner networks represent students, early careerists, mid to senior level executives, physicians, nurses, and other industry professionals that seek to connect and share best practices. We welcome you to connect with NALHE and the NALHE chapters listed on our website at www.nalhe.org. And we also invite you to think about starting a NALHE chapter in your region if one does not exist today. At NALHE, we're really proud and thankful to have multiple health industry partners and sponsors. For NALHE Tri-State Chapter, we have Hartford Healthcare in Connecticut, New York City Health and Hospitals Metropolitan, and Mount Sinai in New York. In these partnerships is the key to ensuring that together we work across market and competitive boundaries and have core values and a unified priority to create inclusive opportunities. We welcome a connection with your organization to consider sponsoring future NALHE events. Now, we are all here tonight and to get to know who is Maria Trusa. She is an author, an entrepreneur, a human rights advocate for children. She is a philanthropist and a public speaker, a leader in the healthcare field in New York. Maria was born in the Dominican Republic and immigrated to the United States at the age of 15. Trusa is the owner and CEO of Forme Medical Center and Urgent Care in White Plains, New York, together with her business partner, Gina Capelli. Since joining Forme in 2015, Trusa has focused on creative and entrepreneurial solutions to provide quality healthcare in a medical membership model for the vulnerable Latino community, undocumented and uninsured families. In 2020, Maria Trusa founded the nonprofit organization Yo Digo No Más, I Say No More, which focuses on raising awareness of the prevalence of child sexual abuse, especially in Latino communities, and at the same time helping survivors of sexual abuse break the silence and cycle of abuse through prevention and education, providing mental health resources and tools for survivors and their families. This organization originated from the publication of Trusa's autobiography, Yo Digo No Más, which narrates the early years of her childhood in the Dominican Republic, where she suffered a traumatic sexual assault at the age of 9 by a friend of her father. This experience nearly cost Trusa her life and has impacted her facet of her being. More than 3 years ago, Trusa began sharing her transformative story of convergence of her own personal and professional growth in facing this trauma from her childhood. A lifelong avid athlete, Trusa enjoys challenges. She has partnered in the New York City Marathon and completed her first Ironman 70.3 triathlon. Trusa is a proud mother of 3 and a grandmother of 3. The businesswoman spends her free time skiing, enjoying time with her family, and traveling the world carrying the message of her organization, Yo Digo No Más, I Say No More. That is an amazing bio. Like, I don't even know where to begin. I am just in awe of you. But I would love for us to start first with questions in regards to healthcare. So my first question is, why did you choose to be in healthcare?
You know, Melissa, first, I want to say thank you for having me here, because every time I get to speak, I feel blessed because I have an opportunity to make an impact. And before I leave this world, I plan to impact millions of people, and I'm on that journey right now. So thank you so much for giving me the platform to be able to do that. I was listening to you read my bio, and it's interesting because obviously I know my bio, but as you were reading it and you were telling part of my story, there's a book that says the body keeps a score, and it hit me. Like I got emotional just listening to you say the words that I say, you know, about my trauma from the Dominican Republic. But to answer your question, healthcare for me, I wanted, since I was a little girl, I wanted to be a doctor. In my family, this is like in our genes. And when I came to New York from the Dominican Republic, I was 15 years old, and I got married at the age of 17. I had a child at the age of 20. So the dreams of becoming a doctor for me at that time became impossible. I was in a very abusive relationship with another broken soul, my ex-husband. And I ended up becoming a medical assistant because I wanted to be in the medical field. Like, to me, this was like what I was born to do. Like, I knew I wanted to help people. So I ended up, after high school, going into medical assistant school. And the medical assistant school for me opened the door to have this amazing career of 26 years at a medical practice, where I grew as I went to school, and I became the executive director of a medical practice in Scarsdale. And I ended up, to make it long story short, I went from having 7 doctors to 50 doctors, from having 35 employees to 250 employees, from 10,000 square feet of medical space to 70,000. So for me, that opportunity that was given to me for 26 years, I felt that was when I arrived. Like, I was in heaven for 26 years working in the medical field, knowing that I couldn't be a doctor, but I could still make an impact.
Yes, no, that for sure must feel fulfilling, you know, at some point. If you were to be a doctor, what would you have been?
I think I would have been an internist. I like the holistic. I think internists have a way of being able to help the patients in a holistic approach. I mean, the way that I see it, it's like you're caring not just for their body, but also mental health. Like, you are leading them in life. That's how I feel. So for me, it would have been an internist.
Okay.
Sorry. There we go.
So
Technology.
Technology. So being the CEO, what obstacles did you encounter to get to forme, I guess you could say?
Wow. So, I had an experience when I was age 50 where I almost died. I have in my book, I share my entire story, the good, the bad, and the ugly. There is no, it would be one of the most authentic books that you would read if you get a chance to read my book. I say no more, yo digo no más. I talk about that experience because for me, after 26 years, I thought I was going to stay in this practice and I was going to be retired. And then I have this, I used to have breast implants, and one of the implants burst. And I ended up having 5 surgeries within a month and a half, less than a month and a half. I have 5 surgeries, and in one of the surgeries, I almost died. I mean, my family came to say goodbye to me. And for me, when I woke up from that surgery and I got a chance to go home again, everything changed. It was like I knew that I had spent the 26 years in this medical practice, growing the practice, understanding healthcare, to an immense level because I was the leader of this practice. I grew this practice and I have built an amazing team. And I went to the practice and I said, I'm leaving. And everybody was like, what's going on? Including
Yeah.
my family. My mom said, mija, pero tú estás loca. ¿Qué te pasa? ¿Cómo es posible? She couldn't believe because I was, Melissa, I was making a lot of money there, had a prestigious job, and they loved me there. So I said, I don't, this is the vision that I have. I want to create a medical center that is going to take care of our Latino community in Westchester, where I live. There is not many places for our community, especially the undocumented population. And I decided that I was going to open up a place that it was going to be dedicated to the undocumented people that don't have insurance, that don't have access to being able to get insurance. And I was so clear on my vision. It was to the T. And I said, I'm giving myself 3 months. And I even told my ex-husband, that became an ex-husband, because he didn't even support me on this.
Oh.
Said, I just need 3 months. I said, I've worked all these years. We are financially stable. We have financial freedom. Why can't I just do this? Anyway, I left anyway. And in 3 months, I joined my business partner, Gina, on this journey. That is almost 9 years ago. I just knew I needed to take care of my undocumented population.
Oh my gosh, that is so impressive. Just the fact of like you having that vision and that the grit, like you had your ex-husband going against you, and who knows who else standing against you.
Yeah, including the doctors. They were asking me, do you need more money? I said, this is not about money. I had a calling. We all have at some point a calling. You either listen to the calling or you don't. I listened to my calling. I had that experience that sort of opened my eyes. I learned healthcare for this. Like, I knew that I was meant to be taking care of my Latino community in Westchester.
That is so impressive. Wow. That is amazing. And the outcome of your success, just shows that, when you're passionate about something, when you're good, when you love it, like there's nothing holding you back. There's no barriers. Like you are in tunnel vision, and thankfully you and your business partner have just created this great, success story, for the undocumented Latino community. So I commend you for that. That's amazing.
Thank you so much. Thank you.
So we're always curious about what a day, it is of a Latina CEO. So can you give us an example of what one day looks like for you?
So I can tell you that I've learned to be my numero uno. So the way that I start my mornings is I wake up usually at 5:30. I work out for about an hour. I then get my child ready for school, and then I meditate. I take a cold shower, and then I listen to either a podcast or an audible book as I'm getting ready for work. And I take about 1 hour, because to me, so I spend about 2 hours with me in the mornings religiously. To me, what I have found is that I create the foundation in the morning that is going to allow me to have a killer day, a limitless day. But if I don't focus on me first, then I'm not able to give it all. So I go to the office, I start my meetings. I normally have a lot of meetings. I am in my office, I am the operator. Like I take care of the medical practice. I deal with the doctors, I deal with the staff. And then my business partner, Gina Capelli, who I adore, I happen to have the most incredible partnership. And I think that makes it so much fun. And we go through the stages, because this is not easy, guys. I mean, let me tell you, having a business, owning your own business, you're going to be challenged to an extreme level. And when you have a partner that you like, that you respect, and that she has the strength. Your strength are her weaknesses, and her weaknesses are your strength, and you make this magical partnership that makes it a lot easier. So normally I have tons of meetings, and then I take my time to, I always focus on making sure that, for example, I do a lot of texting. For me, the texting works best. And then I have an assistant. So at this point, I have an assistant that is incredible. And I delegate. I am one of the biggest delegator. The art of delegating, there's an art to it. And I think, people tell me, how could you do so much? Is number one, I am extremely focused. And why am I focused? I'll tell you why. Because I forgive to live. I don't hold grudges. I forgiving everyone that does me wrong. Everyone. I don't give my energy to anyone that has done me wrong. And as you read my story, I could have a lot of resentment, and I could have revenge in my heart. I don't have that. I focus on living this beautiful, limitless life. I focus on finding the magic of the day in everything that I do, because there's always magic, even when there are challenges. So my day goes from 5:30 in the morning, and it could go until 9 or 10. Look, I'm here with you. It's 7 o'clock. This is part of, being in the networking world, and also connecting with people and impacting the world. It could end at 9 o'clock, and it's a lot of work, but I don't feel like it's work, because I love what I do, which is something that I feel blessed that I've been able to create this, that I love what I do.
That is very heartfelt, and I can see it. I can see it. I'm like, wow. I feel like I was just like a little like, um, what's it called? A little angel right next to you, just like encountering your day. And from a lot of the leaders that I've spoken to in the past, they've always said they start their day at 5 or 5:30 in the morning. So you just saying, I start my day at 5:30, and that time is my time. That's what CEOs have said. And I'm like, wow, everyone that's watching this, if this is the path or career path move that you want to take, you have to start pushing that clock to make sure that you are prepared for a limitless day, which I love you just repeating limitless. Like I really, really like hone into that word.
Yeah, I live a limitless life.
Yes.
It's a beautiful life. It's a life with challenges, like everyone. It hasn't been easy. And if you read my book, you will see, like, how could I live this life and feel this happy about everything that I've gone through. I've found a way to fuel my trauma, and I use it as gasolina
Yes.
para el alma,
Sí.
y para llevarme a vivir esta vida sin límite. It's as simple as that, but it's not simple to get here. We have to work at it.
Yeah, no, absolutely. So talking about challenges, what takeaways have you learned about leadership throughout the pandemic?
I say leaders that are successful, they can adjust. Is when you are able to adjust, you are looking at the solution. You don't stay stuck in the problem.
Mm-hmm.
And I'll tell you, during the pandemic, I am taking care of now, as I mentioned, we focus on taking care of the uninsured community and the undocumented population. So what happened to us is that now we have thousands of undocumented people, beautiful patients. But the challenge was that during the pandemic in Westchester, if you notice, during the pandemic, New York was number one, then Westchester was number two. And we have all these patients. I'm getting phone calls from funeral homes that our doctors have to sign death certificates, and no one wanted to take care of my patients. No one. White Plains Hospital, other places. In the challenge for our patients was that a lot of them don't have an ID. So if you went to Westchester Medical Center, you needed an ID and you needed a car. You needed to drive to get the test done. So I remember crying about this and talking to my son. We had to close the office, but I stayed in the office every single day because we have these patients that we were taking care of through telemedicine. And since we have a lot of the patients that do not have insurance, I was there to collect the money, for them to pay and guide them. So my son said to me, Mom, you figure everything out. Just focus on the solution, like you always say. And I said to my business partner, we got to do tests here. We have to figure out how to do it here. To make a long story short, we put a tent in the building. Outside of the building, we put 2 tents. I grew the office. We started with 20 employees. In through 2 weeks, almost 3 weeks, we had 90. We ended up doing 120,000 COVID tests during the pandemic. On the first day, we had 150. And then we ended up doing 700 tests per day. And I opened for 2 years, every single day. I adjusted because my heart was in the right place. Number one, I said, I don't care if you have insurance or not. You come here, we're going to see you. We're going to do the test. We're going to take care of you. We were not just doing the COVID test. We were actually checking the vitals. We sent patients from the building, in front of the building, to the emergency room. The ambulance will pick them up, and we risk our lives. I was there guiding my staff. I was the leader. And I said, I'm not going to let my staff risk their lives if I'm not risking mine. And I'm going to risk it for my community. I'm going to show God, because I said, God led me into this mission. I was going to show God. I said, you see, you put me here. I'm going to show you this is from my heart. And God led us to have a very successful few years. Very. The irony is, when we were taking care of the undocumented patients that didn't have insurance, they were coming, and I said, if you have no money, I don't care, you're going to be seen. So you don't have to pay. The government came out with a CARE Act. The CARE Act was paying $100 per test, and they made it retroactive. So all that money came to us later on. But what a true leader does is that you adjust. You do not stay stuck in the problem. You find solutions. When you stay away from the problem, you focus on what's my solution. And that's what we did. We had a very successful financially, but more successful from the heart and soul, because we helped so many people.
God bless. I am so happy for you. Wow, like the pandemic was really something that we were not ready at all whatsoever.
Yeah.
And like you said, your heart was in the right place. You were in the front lines.
Yeah.
There were some people that weren't on the front lines, and the fact of you just saying, my staff, my people, my community, this is, it's just so amazing to hear, and just I'm in awe. I'm still in awe. But I'm glad that now we're on the other side, thankfully, that we've survived the unfortunate pandemic, and that we're trying to adjust into like normalcy, the new normal, as they say. So curious. I mean, I know your life story of like, you almost died, and and how, how your life completely changed. I'm curious, do you have like a mentor that you go to for advice, recommendation, or who's helped you navigate in the world of healthcare?
I think you have different mentors. I had when I was at Scarsdale Medical Group, quite a few of the doctors became my mentors. And then, I mean, you need people by your side. You can't do this alone. You have to stop being afraid to ask. It's so interesting because I do a lot of public speaking engagements. And there was one test that I did. I spoke in front of about 100 people, and everybody was asking me for their business for my business card. And I give you my number, my cell number. And out of those 100 people, 2 people reach out to me. And I never forget this girl that reached out and she said, you talked about your home. I have a home in Vermont. I have 12 acres in Vermont, and I call it Escapo because this is where I escape. And she said, when you were talking about the house, like I want to see it. Like I want to be there. Is there anywhere I can go? I said, sure. Bring your family. I'm going to be there this weekend. And she actually came with her kid and her husband. And I said to her, you see the power of asking? We think automatically that the person is not going to say yes. And the other thing that we have this perception, like people, because they have a title or they might have more money than us, that they're like better than us. Nobody's better than you. We are human beings together. And when you take that equation out, I can speak with the president of the United States and I will be speaking with Melissa. It doesn't matter to me, the title, the money, because I know that we eat the same way, we go to the bathroom the same way, we are born the same way, and we're going to die. All of us. No matter how much money you have, look at Steve Jobs, right? This is a multi-billionaire. Money couldn't save him. And we all suffer the same things. We have family issues, we have love issues, we have heartbreaks, we're human beings. And when you realize that, then you can ask for anything. I ask for everything that I want, and with love, kindness, and respect always, but I ask for anything that I want. And you'll be amazed how much I get because I ask. And that is something that in going back to the mentor, you can ask people to be a mentor. Don't be afraid. It is nice to have a mentor, but nowadays you have a mentor in YouTube. You have a mentor in podcasts. You have books. I am obsessed with Audible books. For me, it's very hard to actually read a book because I get tired at night. I have long days. So what I do at night, and I'm going to recommend this to all of you, I have a today's magic journal that I created. And I write the magic of every day. So when I go to sleep with the magic of the day, and I wake up looking for that magic the next day. I'm telling you, I've been practicing this for now probably 2 years. I freaking love it. It works. So going back to like books, oh my God, there are so many books. I am obsessed with books. And people say, well, when do you have time to listen to the books? It takes me an hour to put my makeup on, to take a shower. I go to the shower with listening to either a podcast or a book. And I am in the shower in my bathroom for about 45 minutes listening to a podcast or a book. I listen to a book per week. One book per week.
Wow. Okay. I don't want to jump, but I want to know your list. Okay. So
I
because
can give you a way that
we're
you
gonna
can
do it
find
right
my
now.
list.
I'm sure everybody is right now like with pen and paper or ready to write down this information, because I for one try to be an avid reader, but it's hard. You get sleepy, you're tired, you either have it on a Kindle or a physical book. And Audible right now is just the way to go because you're on the run, you're driving, you're commuting, you're multitasking. So now let's go with podcasts. So what is your go-to podcast?
You might be surprised. I listen to Dr. Andrew Huberman. Andrew Huberman is a scientist. He's a young scientist and he's good looking. He's good looking. That helps. So what I love about Andrew Huberman is that the way he brings science, he makes it so that it's so easy to understand and so interesting. So for me, I listen to his podcast. He's my number one. And you can look him up. I mean, he has millions of people that follow him, and he's down to earth. He's somebody that has struggled in life, and he shares his story. And then he brings amazing people to his podcast. So it's Dr. Andrew Huberman.
Mhm.
I listen to inspirational YouTube. Whenever I want to get inspired, I say, "Hey Siri, find me YouTube videos inspirational for less than 5 minutes." And you have a list. Oh, Siri is answering me. I talk to Siri all the time. But so I do that. And then for my books, I share my books in my website, mariatrusa.org.
Okay.
So I update that list periodically. So if you want to see the books that have been, but for me, I can tell you that The Magic of Thinking Big has been, that was incredible. The Power of the Subconscious Mind. Oof. That book, we should all read it, because being an entrepreneur, being a CEO, you need to understand what's going on here. Those conversations that you're having that are leading you into decisions that are not the best decision for you. Like with that book, what I learned, Melissa, for me has been like, it was the biggest eye opener. Over 95% of the decisions that we make it with the subconscious. Only 5% of the decisions are made with our conscious. The subconscious is built from when we are born until the age of 12. Wow. Think about that. You had no control of the subconscious, the data bank that you pull every time you're faced with a situation. So understanding that for me made me extremely curious about my past. And I come from a past of I am worthless and I get abandoned. So all of that, I had to rewrite the story, because for me, this story that I had from my subconscious was leading my life. So I got into toxic relationship, abusive relationship. I had a horrible relationship with money. I felt like I could never do anything right, that I was worthless. So to rewrite the story, you need to understand your story, and your story is in your subconscious. Even if you think you forgot, my trauma doesn't really affect me, I don't let it affect me. I hear that a lot. I used to say the same thing. Oh, no, it doesn't affect me. It's leading you. It's leading you. And if things are not working in your life, you need to look back and you need to say, okay, let me understand my childhood. Let me understand the programming that I got. Your parents did the best they could. They had their own trauma, their own, programming. But you now have responsibility for your own programming, because you can reprogram yourself. So for me, that book, the power of the subconscious mind, it was powerful. But I have so many, I could keep going here, but you can find them all in mariatrusa.org.
Okay, everyone, you heard it first. mariatrusa.org. If you want to get into those really good nitty-gritty books. I feel like with you, I'm having like a therapy session. I'm sure everybody here is feeling that same way too. Because you're just dropping all this knowledge and information. And I know that since we're going down this path, I want to switch it up to in 2022, how you founded the nonprofit organization Yo Digo No Más, I Say No More, which focuses on raising awareness of the prevalence of child sexual abuse. I'm curious to know what initiated this mission for you.
So my son Jeffrey, I have 3 kids. Franco, that's 39, and then Jeffrey is 33. He'll be 34 soon. and Natasha, that is 15, my daughter. Jeffrey, I was skiing with my two boys in Colorado, and Jeffrey, we were waiting for my son Franco, and he was late, and we were having a drink, and my son said to me, Mom, you cannot leave this world without telling your story. He said, you have to write a book. Please, Mom, you need to write a book. If you don't do it for the rest of the world, just do it for our family. So I said to him, let me think about it. A week later, I get asked to be on a documentary. And the documentary, which I can share with you, actually, there should be a link in my mariatrusa.org too. The documentary, there were 5 stories, and I was the Latino story. And I ended up going to the Dominican Republic, and I ended up actually filming in the place where I was raped. I ended up filming there. And I went back to my childhood and reconnected. So I said, well, this is the time for me to write the story. So I wrote my book. I started writing it in 2018 and ended up finishing in 2019. And then it was published in 2020. I was self-published. It came out just before the pandemic. And I had 250 people for my, the book, the launch of the book, and we had to cancel it because of the pandemic. So during the pandemic, I started doing a lot of virtual interviews. I was on CNN, I was on Univision, Telemundo, and I started talking about my story. And oh my God, then everybody started opening up to me, including a lot of the people that I knew, girls that I mentored. And I was like, wow, there's a silent pandemic. And that led into one day when I was in my house in Vermont. I had brought 10 women. And out of the 10 women, because I enjoyed sharing my life with everyone, and I bring people to my house in Vermont because I feel, especially Latinas, young people, I want them to experience this world, skiing and being in nature. This is amazing. So when we were in the jacuzzi, 8 out of the 10 women had been raped when they were kids.
Oh, wow.
8 out of the 10. I Say No More came out of that night. I started screaming, yo digo no más, yo digo no más. How is it possible? And this led into me opening up the movement, then realizing that there's so much work to be done. So I became a 501c3. And listen, Melissa, I've put $1 million in the movement in 3 years. Because when I realized that every 9 minutes a child is sexually abused in the United States, that over 93% of that abuse happens at home, and that only 30% of the cases get reported, I could no longer just not do anything. To me, this became my legacy. It has become my biggest purpose. I cannot tell you that there's not an hour, every day I have to make a difference when it comes to this pandemic. I call it the silent pandemic of sexual abuse of our children. And it affects every family. And let me tell you, even if you don't think it does, it affects every single family. And it needs to stop. We need to stop normalizing sexual abuse. We know it's happening, and we are not talking about it because it's a family matter. And we are taught, there are social norms that have taught us to, whatever is in the family stays in the family. Los niños respetan a los adultos. Tú te callas. The children don't have a voice. That needs to stop. Children should not be sitting in anybody's lap, and children should not be forced to kiss or hug anyone. So there are social norms that need to change. And for me now, with the movement, we've done amazing things. So the mission is to break the silence, because the silence feeds the pandemic. We don't talk about it. Look, it took me 47 years to tell my story. 47 years. So I want to make sure we stop that. I want to make sure that we give a platform for people to tell their story. And the other thing is we need to educate to prevent. We need to prevent, because when children get abused, like what happened to me at the age of 9, my life was shattered into a million pieces. So to put it together, I've been blessed that I've been able to do that. But most people don't get to this level. Most people, they stay in victim mode, they stay stuck, and they pass this along to the next generation. It's a transgenerational trauma, and it needs to stop. And the other piece, so there's 3 pillars: break the silence, educate to prevent, and then how do we heal? How do we heal? My next book, which I want to announce that I am writing, my next book is called Parenting Through Trauma. It is my journey of parenting. And I can tell you that I can write it because my relationship with my kids is amazing. And not just that, but for me, the most proud job that I've done in my life is the job of a mother, especially because I come from such a trauma and such a destructive decades of my life, and to be able to build this and stop generational trauma. So it's become a huge force for me now.
That was deep. That was very deep. And I just thank you for your passion. I thank you for sharing your story. I thank you for everything that you've done to create this movement. Because like you said, if you haven't experienced it, you've heard of it. I know I've heard of it through other families. And so now that I'm a mom, I'm very protective of, I need to know where my child is at all times. And no, I'm not doing that. And I'm not doing that. So I'm looking forward
You
to
need to, we need to teach parents, how do you start talking to your children so that you can protect your children?
yes.
I need funding. You see, I invested $1 million, but this is not my movement. I tell people this is our movement. We need to unite. I have a gala coming up. It's my first gala, and I'm going. Yes, it's the 29th of this month, and it is my goal there is to raise $300,000 at least. That's the minimum, but we're looking for more, because I have a curriculum that I'm working on to bring to, and I already got the Yonkers Public School District that agreed to do a pilot program to start teaching children what is sexual abuse, what are the different types, and obviously we're going to start with 8th graders. But the idea is to create a curriculum from the beginning. And so I'm working with 2 curriculums, one for the parents and one for the children, because we have to protect the innocence of our children. When you steal the innocence of a child, you stole their creativity, the wow factor that needs to be protected. But in order, you're a mom, it is our business, all of us, to get together to make sure, to unite together to make sure that the innocence of our children is not stolen. Because when my innocence was stolen, the darkness set in, and the darkness was leading my life. That light of a child, that wow factor, gone. There is the pre-rape child and post-rape child. And that pre-rape child was a happy, poor child. I was very poor, but that wasn't bad. Like, to me, this is what I knew. I was poor and it was okay. But when I was raped, that light was stolen from me. And that light, Melissa, is stolen from many children. And we cannot continue to know this and not do anything about it. It's, I talked so much about this, and it's emotional. It's just, I know so many kids are hurting, and not just kids, but the adults that are carrying this in silent and never talking about it. And it needs to stop. But in order for it to stop, we got to break the silence, because the abuser has the right to continue to abuse when you don't speak. So normally they don't abuse one child, they continue to abuse many children. And also there are statistics that when you get abused, you could have a tendency of becoming an abuser. So
Yes.
we are creating abusers.
Yes.
And it just needs to stop. It
Yeah.
needs.
So one of our guests says, I need that book. Parenting through trauma is so difficult.
Yeah, it is. It is. And when you read my book, so one of the books, and just so you know, when you buy my book, you're going to be donating money to the movement, because I've given my proceeds of my book to the movement. When you buy my book, I Say No More, Yo Digo No Más, it's in Spanish, English, and it's in Audible. So no excuses.
No excuse. You're going to be in the shower listening to that.
You could be in the shower listening to me. And I can tell you that in that book, I share the good, the bad, and the ugly. And I share the ugly because I want to show you the face of trauma. I want to show you what someone with major trauma is capable of doing. And I share stories there that I did that I am not proud of, that I had a lot of healing and a lot of forgiving to do to myself because of my trauma. And, there's a book that Oprah Winfrey, I just read not too long ago, listened to her last book, which is What Happened to You. And she talks about, because I believe that we are all born good. So you are born into an environment that is going to do the programming for you. So that programming either makes you good or bad. It leads you into a bad road or a good road, a destructive road or a constructive road. And for me, that I've forgiven myself. But in my book, I said, if I'm going to write my book, it's going to be completely authentic. So I share with you all of my tools. I've used many tools to get to the peace where I'm at, because I live a life of forgiveness and peace. I have peace. I have peace with my story. It's still in my life. I feel it sometimes because the body keeps the score, but I'm okay with the story. And I've forgiven my dad. I've forgiven the person that raped me. I've forgiven everyone, my ex-husband, the people that have hurt me. I don't waste any energy on anyone. I protect my energy, and I learn to forgive to live.
Wow. That's very, I know a lot of times people say, you got to forgive. And a lot of people say that they have, but that they haven't, because they haven't, undergone like that recovery and coping and, just really releasing that pent up energy, and you can tell based on their actions, based on what they say. But clearly, Maria, you're authentic, and I can tell that you're light. Your spirit is light. Like, even though you've gone through so much trauma and you've experienced so much turmoil, I can tell that you're just vibrant and you're clear, and you're just like, here I am, this is me, like no regrets, no harm, no foul, like, and that's that says a lot, and that's hard to come by. You don't often see that. So I really, really, truly admire you. And it's there's a lot of blockages. A lot of times people are like, you I don't know if you've heard this, but oh, you're a brick wall, or you have no feelings. And
Yeah.
and that's like, okay, you have to chip on that and, work on it little by little, whatever that looks like. So thank you for sharing that your next book. At
Yeah.
this time, I would love to, see if there's any questions. I know that okay, so Jose wrote The Body Keeps the Score is a fantastic book on trauma.
Yeah.
Um, Taina says, I love that she incorporates holistic modalities and centers herself before the day.
Yes.
And one question I received earlier is, how did you come to terms with not pursuing medicine and taking the administrative route? Do you ever look back and think, what if?
No,
Okay,
because
that's
what if it couldn't happen anymore? But I have to say, listen, this is after doing a lot of work. I used to say, but it's like, I don't know, because the story happened the way it happened. So the only thing that I have control of now is today. How am I driving my life today? What chapters am I writing based on the chapters that were written, and how could I do it better now? But not if. I'm blessed that I'm in the field. I own a medical center and urgent care. I have doctors working for me. And to me, that is a blessing. So I didn't get to fulfill the dream of being able to take care of patient myself as a physician, but I actually have thousands of patients that I open my doors for them to be taken care of. So I feel blessed. I don't live in what if, I live in what it is.
That's true, 1000%. I agree with that. So I know I don't see any questions, but I do want to remind everybody that's in attendance that we are, giving away the book of Maria Trusa. And how would you? Okay, so this is me telling the audience how you can win a copy. This is what you have to do on LinkedIn. You have to take a screenshot right now, take a snap. um, Please share a takeaway from what Maria Trusa shared. You have to, like check out Maria Trusa. Is it .org or .com?
That
Maria
or
Trusa.
that
Okay, you're gonna have to put like, please check out mariatrusa.org, because
and
I
make
also
sure that you connect with me in LinkedIn.
exactly you have to connect with Maria Trusa and follow NALHE Tri-State as well. You're going to take a picture, key takeaways of, this fabulous conversation with her. And you're going to have to hashtag Yo Digo No Más. And to get a copy of her book, because you're trying to win one. And definitely, put her website as well as nalhe.org on LinkedIn, because we want to definitely show Maria Trusa, that the love that she provided to us. I want it to be replicated on social media. I want it to reach the masses. I want her gala to be a success and for her to meet her goal. Especially, I'm super excited to read your book as well as the upcoming one. And let's see, someone wrote, thank you for sharing your personal traumas and showing how you can turn those around to keep other people. I'm inspired by your accomplishment. Keep shining. Thank you so much, Reina Garcia. I hope that you enter the competition on LinkedIn. Jose wrote, tag us at nalhetristate.org. Absolutely. Okay. So someone, Maribel wrote, Maribel, thank you so much. Maribel was the one who connected me with Maria.
I love Maribel. Thank you so much, Maribel, for everything. She's been such a supporter of everything I'm doing. I appreciate that.
Yes, she is amazing. She wrote, what would be your advice for young professionals who are not really sure if they want to become healthcare administrators or become a doctor?
Look, reach out. Like, for example, I bring some people, especially Latinas, I have to say, or Latinos that wanted explore. I think it's important if you can get into a practice like my practice, where you get to spend time with the doctors, with the nurse practitioners, the PAs, you get to spend time. If you're not sure, then you'll find out. And again, going back to what I was saying, ask. What's the worst that could happen? They could say no. You know how many people have called me and asked me if they can shadow in my facility. And there's a lot of small practices. You might have a hard time doing this in a big hospital, but there's a lot of small practices, urgent care, medical centers that are small, and they're willing to do this. I do it. And I had this week actually a young lady that wants to be a doctor, but she's not sure. Should she go to PA? Should she become a PA? And she's shadowing the doctors and she's shadowing the urgent care providers, and she'll figure it out. Don't be afraid to ask. That's the main thing. But I think you need to explore because they're totally different. Some people they don't want to take blood, they don't want to give injections. It's very different than just being an administrator. And as an administrator, you don't have to deal with that. So for me, I mean, my dream was to be a doctor. I ended up, like I said, running the practice, but I just, because of my circumstances growing up in my life, as you will get to read in my book, I didn't have that chance, but you could always turn it around and make it work for you.
I feel that you actually ended up doing much more.
God, yes.
Right? Because I feel like if you would have gone the doctor route, okay, this is a doctor route, you're going to be limited, but you've actually done double or triple or even quadruple what you would have done if you would have been an internist. But that's the way I see it. Like
I agree with
your movement, your mission, your passion, your goal, your recovering of traumas, your vibrantness, you everything that encompasses you has really like fulfilled, who Maria Trusa is. Jose wrote, someone I spoke with said, I am not taking care of patients directly, but I support those that do.
Yeah.
And that's something that I say as well. Like
you're part of the system. Like
yes.
I tell my staff, even my cleaning lady that I happen to love, I tell her, you are part of the system. We are supporting our patient's life together. It's you could do it in so many different ways. I love healthcare. I am blessed that 35 years or more I've been in healthcare doing what I love, and that is priceless.
Yes, no, absolutely. But I'm just very excited for what's next to come for you, Maria. Like truly, this conversation, like I'm looking at the time, it flew by.
Yeah.
And it was just remarkable to just hear directly from you. And I've seen you on social media, and I'm just like, wow, what a powerhouse. Definitely I need to, know more about her. Yes, her healthcare side, but as well as the movement and the mission that you're on. So I hope everyone, got a lot of nuggets from her. I know I sure did. And I'm looking forward to having all this like on LinkedIn. Please, I hope to be able to provide a winner by 12 p.m. tomorrow, 12 p.m. Eastern time tomorrow. So please remember to tag hashtag Yo Digo No Más, mariatrusa.org, at NALHE Tri-State, what key takeaways you took of this beautiful CEO, Latina, and, we're going to just 1000% be in support of her. Please follow Maria Trusa on LinkedIn or other social media outlets. She is amazing. She is a powerhouse, and I just cannot wait to go to Vermont because I'm going to ask you. NALHE Tri-State. NALHE Tri-State is on the chat right now with me saying we're going to have a reunion in Vermont. So, but it's the power of asking. So for the early careerists, definitely I am very much an advocate of asking, not being shy, utilizing your personal skills, your communication skills, because you just never know. The worst that can happen is they're not available. They can't do it. No harm, no foul. You keep it moving with a smile on your face, because you just never know what anyone is going through personally, as we can all see. But I would just like to end the session. Thank you so much, Maria Trusa. Thank you so much for everything that you've done for the community, the Latinos in healthcare, as well as the Yo Digo No Mas movement. 1000% my support, as well as everyone. I just don't know who would ever oppose to
Oh,
yo no digo no más. I'm sorry. I just don't see no negativity in that at all whatsoever. And I hope that the movement strives and continues to blossom and grow, and that we continue we put an end and stop to the silence.
thank you so much. And
And so
if I could just say one last words,
yes.
I want you to understand that the limits that you're creating are here. In what you think, what you speak, you create. The power of your thoughts, please be careful, but
Mm-hmm.
switch them. You can rewrite the story.
Yes. I live by that too. I do live by that. Positivity always.
Yep.
No. But yes, but thank you so much, and we'll see. We shall see. I guess we shall meet again in person.
I'm sure we will. We're going to Vermont.
Yes, we're going to Vermont. So everyone have a great night, and we hope you'll catch future NALHE Tri-State events, and we'll see you soon. Thank you so much. Have a great evening, everyone. Bye.